Good afternoon. My name is Mary Fran Tracy. I'm an associate professor at the University of Minnesota School of Nursing. My co-moderator for today's session is Dr. Brady Granger, who's a professor at Duke University School of Nursing and the director of Heart Center Nursing Research Program at the Duke Margolis Center for Health Policy. Brady and I would like to welcome you to this webinar, What is Staff Nurse Engagement in Research? It's sponsored by the Clinical Nurse Scientist Special Interest Group of the Council for the Advancement of Nursing Science. And we're excited that so many of you took the time from what I know are your busy schedules to join us today for this presentation. I'll be introducing our speakers in just a moment, but I wanted to begin today by saying a few words about our special interest group for those who may not be familiar with it. Brady and I are the current co-chairs of the SIG, which has several goals: to provide opportunities for networking among nurse scientists who are based in clinical settings, to provide professional development programs such as today's webinar, to provide opportunities for mentoring and problem solving among SIG members, and in the future, hopefully, to provide an avenue for investigators who mentor staff nurses to engage as research sites and collaborators. So there are many benefits to being a CANS member, and joining this SIG is one of those benefits. As we get ready for the webinar, please note that we're going to have approximately 40 minutes of presentation, and then we'll leave 15 to 20 minutes at the end for questions from participants. As you formulate questions throughout the session, please feel free to enter them into the Q&A box at the bottom of your screen. So we'll cue them from there and ask our panelists the questions as you at the end at the question and answer session. But you can feel free to enter them throughout the presentation as you think of them. All right, so now on to the introduction for today's speakers. Our first speaker today is Dr. Ruth Bryant, who is a principal research scientist in nursing at Abbott Northwestern Hospital in Minneapolis, Minnesota, a large quaternary care center that's part of the Allina Health System. Her areas of research include patient safety, pressure injuries, subepidermal moisture, wound healing, patient engagement, and healthcare worker well-being and retention. Dr. Bryant's career spans over 30 years as a board-certified wound ostomy continence nurse, and as the director of 2 walk nursing education programs and the co-creator of the first web-based walk nursing education program, Dr. Bryant was responsible for curriculum development, program planning, and knowledge assessment. She's also the founding editor and currently co-editor of Acute and Chronic Wounds, Current Management and Techniques, now in its 5th edition. She's a past president of the Wound Ostomy Continence Nurses and the current president of the Association for the Advancement of Wound Care. Our second speaker is Dr. Stacy Reynolds. Dr. Reynolds received her bachelor's, master's, and PhD from Indiana University. She joined Duke in January 2016 in a joint position between Duke University School of Nursing and Duke University Hospital. At the School of Nursing, Dr. Reynolds teaches evidence-based practice in the ABSN program and healthcare QI methods in the DNP program. At Duke Hospital, she served as a neuroscience clinical nurse specialist for the inpatient neuro units for 3 years. And in March 2019, she transitioned to being a CNS for the infection prevention and hospital epidemiology department. Additionally, Dr. Reynolds coordinates the Duke Advancement of Nursing Center of Excellence Academic Practice Partnership. So we're excited to have both of these speakers here with us today, and we'll start then with Dr. Bryant's presentation.
Good afternoon, everybody. I'm thrilled to be here and appreciate the invitation, Mary Fran and Brady, so thank you so much. I am really excited to talk to you a little bit about my practice here at Abbott Northwestern Hospital in Minneapolis with regard to conducting research and engaging staff in research. So I'm really particularly fond of this topic because I struggled with what it actually means to engage the staff, what's really realistic. I also struggled with defining what research meant here in the clinical setting. So Abbott Northwestern is a large 600-bed quaternary care center, and we're the key center within Allina Health. There's several other hospitals within Allina Health. We're the quaternary center of that part. And then we have, of course, a system with clinics and home care and emergency services and all that. So we have quite a diverse group here of that's available. So when I first came, just to give you a little background on what my role looks like, I essentially took the role over from a retiring nurse scientist, Dr. Sue Sendelbach, and modified it, obviously, to meet the current needs and what I was really comfortable with and what I thought people were asking for. So what I have divided my role into is several components. So I have this research program oversight. So I'm expected to have my own independent nursing research, but I also find that I do a lot of collaborative research because we have a research PhD research scientists that work with our intensivists and hospitalists and with Mother Baby and with our Courage Kennedy Center. So I am lucky to be able to collaborate with them on projects. And then I also provide this regulatory oversight for people who want to try to navigate actually the IRB process. And then as it turns out, you become very involved in advanced practice types of projects. So our DNP student coordination of projects. We have at least 5 or 6 different institutions that we end up having DNP students from, and primarily these are employees. You probably are, many of you are experiencing that same thing where your employees are advancing their degree and then want to do their DNP project at your site, and it becomes important to coordinate that effort. So there's some synergy between the student's project and the priorities for the institution, as well as smooth transition into the IRB acceptance and the approval process, even though we recognize they need to be a QI type of project. And then we have a portion of my role is to actually oversee clinical inquiry in terms of professional development. And that would be my own personal development as well as the nursing staff personal development, professional development relative to clinical inquiry. And when I think about research, I actually think of a broader framework of clinical inquiry to help kind of delineate. I think it's kind of important to delineate exactly what research is compared in contrast with other modes of clinical inquiry. So when I looked at what does staff engagement mean here, we are a magnet hospital, 3rd designation. And so I looked at the document to find out what does magnet say really about research and staff engagement. And so they don't actually use the term staff engagement, they use the term of staff satisfaction. And that's in through a couple of the different sections. But if you look specifically at the new knowledge section criterion, they have specific criteria for research study, and that is that the staff nurse needs to be involved in disseminating to internal audience, disseminating to external audiences, and that's actually real reasonable expectation. We engage the staff in projects so that they in fact can help with the dissemination. And then when it's specific to evidence-based practice, they have specific criteria as far as the clinical nurse implements new EBP. They use EBP to revise existing practice. They incorporate professional specialty standards or guidelines to implement new practice. They use innovation and they demonstrate improved outcomes. And I specified here that it's technology as well as design or redesign of work environment as well as workflow. So that gives me framework as to how to interpret what is realistic or possible or needed in terms of staff engagement. So when I looked at what I do and what it means when I'm trying to convey to others here, what it is that I do, what is when we say nurse researcher, engaging people in nursing research, it just is so hard to define or really explain to others, because I do think nursing's approach is much different than other disciplines. And so I kind of developed this mission in collaboration with the CNO and our directors that we actually support the process of clinical inquiry through all the phases, including, and I list out the different phases of clinical inquiry, basically in research. And we identified as a group that we have a focus in nursing research at Abbott Northwestern. That's really focus at patient safety and nurse well-being. So that helps us be able to steer and guide people towards projects that are really meaningful to what we need here at our institution and our system. And then this acknowledges that we use a variety of methods of clinical inquiry. So it includes quality improvement, evidence-based practice, collaborative research, as well as independent research. This framework helps me identify where can I engage staff, where can I utilize their resources and get them excited about what the opportunities exist in research. So I use several different strategies to engage the staff in clinical inquiry. And when you think about how you do this, it actually is kind of challenging to put it to words, I think, because some of it is so kind of subtle as a part of what you're doing. But the first thing I try to do is really connect with them. And by that, I mean to generate enthusiasm that there's relevance in research to their daily work. And you see lights go on when you can be in their presence and talking about some recent research or new guidelines that might be really particularly relevant to them. So I can ask questions that kind of clarify current practice or what is happening. When I'm connecting with them, they'll describe situations and I can ask clarifying questions to help get at that a little bit more clearly and identify where gaps might be or opportunities might be for activity, for clinical inquiry projects, for research activities. And being familiar with the current research pertinent to their clinical practice, especially patient safety metrics, really critical, and nurse sensitive indicators, helps me to actually connect with them so that I can pull them in with concepts that are meaningful to them and what they're seeing in their practice all the time. The second thing that I use as a strategy is just to be present. And by that, I mean listening to them, hearing them, being physically around. And that can be a challenge sometimes when you are also feeling like you need to be writing or preparing that grant or submitting to the IRB. So, so this is something that a person really has to work into their workflow. But I really want to listen to what staff are talking about. I just want to hear what their experience is. And we do rounds for different things like hand hygiene and things. And I can hear conversations that way. So it can be really informal like that. Or else I can go specifically, we have tiered huddles for safety programs. And I can go to the tier 1, that's basically all the staff on that unit. And I can hear what they're talking about. And I can go to tier 2 huddles where that's more the patient care manager, patient care supervisor, and directors all in different areas that meet. And I can hear summary comments that way. Or I can go to tier 3 where I hear all of those reports from for the Abbott Northwestern Hospital itself. So I can hear all the departments, including laboratory and security and everybody. So you really have a picture at different levels of what's going on and what are the current things that people are experiencing and see where there is opportunity to engage. And basically, by being present, you can kind of provide a broader lens of awareness of clinical issues and hospital system priorities. That's kind of the challenge, is to be able to have that, know the depth of what they're experiencing, but also know what's going on at a higher level with the system. The other way I try to be present and engage staff is through our nursing governance program. And so the nurse scientist sits on with the governing council and provides input and hear a lot of input from the nurse managers and the staff nurses who chair the different councils on our governing council. And then I also collaborate with and oversee the EBP Research Council. I don't chair that. All of these councils are chaired by staff nurses and a patient care manager or a director, but I sit in on the EBP Research Council and provide a lot of input. So it's fascinating to hear the comments and the observations and opportunities that arise from just being present. The third strategy I use is to create opportunities for the staff. I like opening doors. I feel like that's my job, is to open doors and create opportunities. So I do monitor email and share call for abstracts for announcements. I really like referring them to like Submit Theta Tau. And the reason I like that is because I'm astonished at how many staff nurses don't have experience with dissemination. They don't present. We don't have a lot of opportunities for them to present, even as a poster. And so I'm trying to encourage people to do more oral presentations because they're doing some pretty phenomenal work here. So, but Sigma Theta Tau is structured such that it's really kind of a safe environment and small group when you go to do the presentations, because they have so many presentations that they provide. So we've sent people to Sigma Theta Tau a couple of different times, and it usually be a staff nurse, and then we'll usually have someone who's a little more experienced going with them to be able to give them that experience. And then trying to keep my eyes out for local nursing research conferences annually, as well as, the NAON or different specialty nursing organizations when they're national conferences, and having people submit abstracts to those programs. Did not mention, but I was at Washington State University in Spokane and served in this kind of a clinical scholar, research scholar position there. And we had clinical inquiry seminars quarterly. So staff nurses would submit abstracts to present at these clinical inquiry seminars. And that gave them an opportunity to learn how to put an abstract together and do the whole process. We coach them through that. We haven't implemented that here as yet. Having survived COVID, we're looking at trying to do something like that as, starting in 22. And then we have an Ebp Scholars Program. So a lot of great engagement this way. This is funded by our foundation. And we do this in collaboration with an academic partner in the metro area. It's a 9-month program, 2 days per month, that are dedicated to EBP. And we usually have 4 or 5 teams. It'll consist of 2 staff nurses, DNP students from the college, and other allied health students from the college, and faculty from the college. So we teach them the concepts about evidence-based practice, and they identify a project and a clinical question, refine it together, implement a project together, do the whole thing collaboratively as a group. That really gets them stirred up and excited. They really like to participate. But we're so fortunate because we do have this funding from the foundation to be able to pay them have these 2 days per month to work on these projects. We're doing the same thing now with a leader clinical inquiry scholar program. So we are taking leaders and teaching them a little different, more programmatic kind of concepts and program evaluation logistics model for their project. So that'll be similarly based, but a little different focus in terms of what they're going to tackle. Another strategy that we use is to network, and a lot of networking, a lot of just getting to know people, again, being present and getting to know people. And so within the Allina Health system, I have academic partners. We have a research house. A lot of places call it a research institute. Ours is called a research house. So we get to know what other people are doing and partner with them, involved in research house-wide decisions, partnering with the CNS group, our CNO. Safety and QI is critical. Learning partners, understanding what goes on and what they're involved in. Respiratory therapy. So really just partnering and networking with all those. And the tier huddles really make that a process where I can facilitate that and be involved and know who to contact. But as well as between departments, we have several different departments, and when I can round out on the unit, I can hear what people are talking about. I can identify, ask the manager to introduce me to somebody who's doing something I read about or heard about. And when I explore further, a lot of people get involved in doing projects before they actually formalize it into something that is a clinical inquiry format. And so if I can be involved in that, then that really helps a lot. And then of course, we're involved in academic settings too with DNP and master's programs. And then just serving as a resource. So again, this is that professional development. So letting people know that I'll help them with their abstracts, help them with oral presentations, help them get their manuscripts going, looking at funding opportunities, navigating the IRB, and serving as a resource when people are thinking about advancing their degrees. Just a couple of slides to show you some of the variety of projects. Ideally, a person would have an umbrella of topic. In the clinical setting, it's really hard. And then to have just one umbrella, you have several umbrellas, and so that you feel a little bit fragmented. But I really want to do projects that are meaningful to our system as well as to the individual. So we do have a big focus on delirium right now, and we've had several units doing it. So that's been really exciting to watch that one focus on delirium. We have an inquiry in pressure injury. So we have early detection methods with the SEM scanner, and that's been a QI project looking at specific aspects of that I need to understand better, and then can prepare for actually a research project that we'd like to do. But here's the other projects. So you can see they're all over the place. They're looking at code greens, opioid-induced reduction, respiratory depression, OB critical care issues, lab draws, handovers, well-being, ECMO, tube stabilization, skin tears, suicide risk assessment. So you become kind of a jack of all trades, but that's how you get them engaged. And I can help with process. I might not be the clinical expert, topic expert, but I can help them with the process and make it so it's not scary or confusing to them. And then just a collaborative independent research, OB critical care things, the deconditioning prevention program that we're doing for the medically ill older adult, and then looking at a healthcare recovery program following our pandemic. And I've got staff nurses who are really incredibly interested in this. They can't participate in every phase of it, but I can have them, we can meet, get input from them, have them help with certain parts of it, certain components that work with their work time frame. So in summary, for me, what does it mean to have staff engaged in research? It means I have their participation in any one step or component of the research process. It's not the entire process most often, but it's going to be components. And it also means they are familiar with certain tools. If they can even just describe what we use for an evidence table for, they can describe how to do a lit search or how to contact the library to help them do a lit search. That's what I consider engagement. When they begin to realize that you don't jump to a solution when you identify a problem, but you look in the literature to find out what things might be feasible. That to me is a win, and that demonstrates staff engagement to me. And when I hear that they're interested in listening to an EBP or research presentation, say some of those pictures were at a research conference we had pre-pandemic. And it was a great turnout, for us to have people wanting to hear about research in EBP. That was pretty fascinating. So I look forward to hearing comments and questions, and I'm going to stop sharing now at this point.
Well, good afternoon, everyone, and thank you, Ruth, for a wonderful presentation. My name is Stacy Reynolds, and I'm excited to share with you my thoughts on what staff engagement is and ideas for increasing engagement. And a special thanks to Mary Fran and Brady for inviting me to this webinar. So a little background about myself. I have been at Duke for a little over 5 years, and prior to that, I was at IU Health in Indianapolis. For 50% of my role, I serve as a CNS in infection prevention at Duke University Hospital. And for the other 50%, I'm an associate professor at Duke School of Nursing, where I am fortunate to teach evidence-based practice in the pre-licensure program. And I also teach QI with Brady in the DNP program, which are two topics that I really enjoy. I'm also the lead faculty for the Post-DNP Quality Implementation Scholars Program, which I also lead with Brady. And another part of my role is spent as the coordinator for DANCE, or the Duke Advancement of Nursing Center of Excellence, which is our formal academic practice partnership between the health system and the school. It's led by Mary Ann Fuchs, our Chief Nurse Executive, and Vincent Ramos, our Dean for the School of Nursing. And in these roles, I'm able to interface with different levels of staff nurses and students. And I am blessed to have great resources and support at Duke with Brady Granger and also Hutch Allen, who's the Director of Nursing Research and EBP at Duke. And as you can see, my hospital role is as a clinical nurse specialist. So I don't have an actual formal nurse scientist title, but I am able to provide mentorship and guidance to staff nurses. So I am hopeful that I will be able to provide you with practical ideas to improve staff engagement, even if you're not in a formal nurse scientist role. So when we were planning this webinar, Brady asked me, what do you think engagement is? And I responded with, people probably would say just attending meetings. And we know that that is not engagement. It's a start. You must be present to be engaged, but it's not engagement. I know at the hospital, if 30 nurses attend something, this is a good turnout, but is it really engagement? At the School of Nursing, a lot of students attend my classes, mainly because they have to, but this doesn't always necessarily mean that they are engaged. And so when I think of students or nurses who are engaged, I think of these things. They are inquisitive. They ask a lot of really insightful questions, not just about, am I going to get points knocked off for not using APA, but they really ask insightful questions, showing me that they really want to learn the content. Also, they're actively involved. Maybe they're willing to do extra tasks or take on extra work. They also show a genuine interest in and they're excited about learning, and they have a commitment to wanting to do things better. And I know that there are more ways that nurses can be involved and engaged, so feel free to put what engagement means to you in the chat. So now that we have an understanding maybe of what engagement is and is not, how do we get nurses engaged in clinical inquiry? And I know the webinar talks specifically about staff engagement in research, but I'm going to broaden this a little to clinical inquiry in general. And here I have 5 ideas for engaging nurses in clinical inquiry. So first, meet them where they're at. Some have no experience, some actually have quite a bit of experience, and they will need different types of guidance. Next, build relationships, not only with nurses, but also with others that can be a part of your team. Use existing structures that are already in place in your health system and advertise them well, and also share your own personal successes and failures. And now I'm going to go into a little bit more detail into each of these and how you can practically do this. So the first one, meet them where they are. As I mentioned, I broadened my discussion from research to clinical inquiry, really to be able to include QI and EBP. And I think it's helpful to build their confidence with smaller QI EBP projects that they can really get their minds around, projects that align with their daily work and are also system priorities. I work in infection prevention, so I do a lot of stuff around CLABSI and CAUTI prevention. And if I were to ask a nurse to do a huge research study to generate new knowledge on CHG bathing practices, that might seem really intimidating and overwhelming. But if I said, let's do a smaller QI project to improve, bathing practices, let's create a checklist to help ensure this task gets done every day, and we can implement it this week and we'll track it to see if it works, that might be much more tangible and feasible to nurses. Again, this will help build their confidence if they can quickly see that a change they did actually made an impact. And from there, you can progress to more rigorous QI and EBP and build your way up to conducting nursing research once they have some experience. Next, build relationships. And this one helps in so many ways. First, build relationships with those who may also have an interest in clinical inquiry, maybe other doctorally prepared nurses in your health system. If you're the only one with a doctorate, build relationships with others like clinical nurse specialists, APPs, nurses, anyone with an interest. And by building those relationships, you may find that some nurses may have a background in research. At Duke School of Nursing in our accelerated BSN program, there are actually a lot of students who have an extensive research background. And just an example, Brady and I did a study 2 years ago where we had nurses and nursing assistants collect data for us as part of our study. And one nursing assistant asked me just really insightful questions. And I ended up finding out that she had a background in biostatistics and had come to be a nursing assistant to work her way through nursing school. And she was an absolutely great person to have on our team. And I would have never known that she had that background if we hadn't engaged her in the study. Next, you can also build relationships with IRB or regulatory representatives. Reach out to them, introduce yourself, maybe invite them to a research meeting or add them as ad hoc members. And this may make the IRB less intimidating. Next, if you have them, include any magnet or quality leaders who can help provide direction of maybe projects that need to be done that help align with system priorities. And also, if at all available, I highly encourage forming a partnership with any academic institution you may have access to. And I know, of course, I would say this as I coordinate Duke's academic practice partnership, but this can really help expose you to faculty who are doing research. Maybe they could use some direct care nurses with data collection or in other aspects of their research. Also, the school may have experts in QI, EBP, and research that could serve as resources. Duke actually has several faculty that sit on the Health Systems Nursing Research Council. And the school may also have faculty who are editors or journal reviewers that may be able to provide tips on how to publish and where to publish. Next, use existing structures if you can to foster engagement or potentially create these structures. And I've talked with Brady before that, in academics, we are highly incentivized to engage with clinical inquiry, publish articles, and present, because with those things, we get promotions. And we need to make sure that that same type of thing occurs in the health system, where nurses are incentivized or at least acknowledged for engaging in clinical inquiry. And two structures that have been helpful for me has been nurse residency and clinical ladder programs. Generally, nurses are engaged and they are incentivized to complete a project because it will help them go maybe from a CN3 to a CN4. I'm also involved in the Caudy Classy Champion program that also includes a little bit more engaged staff. And there are many other champion programs available within the health system, like falls and pressure injuries and things like that. Again, I use the quality department to help partner and identify priority projects. And recently I began a monthly infection prevention journal club with CEs, and that's generated a lot of interest among that department. And my goal is really to infuse some article critiquing into the journal club to help improve that staff's knowledge and skills around how to appropriately read an article, which will then help them to better conduct projects and write their own manuscript. Also, many hospitals have different types of EBP, maybe courses, seminars, fellowships, scholars programs. I know that there are ones available for a fee online, or they may be homegrown. And I know Duke has several of them. Also, if there are nurses conducting research at your institution, you may be able to partner with them and integrate staff into it, as I mentioned, like as data collectors. And lastly, as I mentioned before, we need to ensure that we are acknowledging and celebrating this engagement. Maybe it's a certificate of completion for going through an EBP course, or maybe they get their name in the hospital email. It can be really something simple, but making sure that we're acknowledging their contributions. Next, I would encourage you to advertise well, advertise the structures that are in place and that nursing research resources are available. And some may not even know that this resource exists. And I know that the traditional way of like posting a flyer in the bathroom, asking nurses to come to a meeting, it just isn't going to work anymore. I have made countless flyers over the years. I put them in bathrooms. No one ever contacts me. So we really need to think outside the box. If you have a marketing and communications department, you can reach out to them for ideas. Or if you don't have access to that resource, think of ways people communicate in their everyday life. It's not through things like flyers. It's through things like Twitter and Facebook and Instagram. And I'm not saying that I am totally engaged with all of those social media outlets, but these may be types of things to consider when you're trying to advertise. I also did a project last fall during Infection Prevention Week where we had a meme contest where hospital staff could submit an educational infection prevention meme, and then the hospital would vote on their favorite one, and the winners got some small prizes. And this was really well received. We actually had over 400 people vote, and we were able to publish this in a journal, and it was just a great way to get staff engaged in nursing research that was fun and interesting. And here I have, this is the winning meme that was submitted actually by one of our ABSN students. Next is really to go to them or to literally meet staff where they are. Generally, no one is going to show up at your office on their own accord and ask you about research. So go to them. Maybe try to make it a goal to go to at least one unit staff meeting a month to introduce yourself. Or maybe set up a table outside of the cafeteria with candy, lure them in maybe with an interesting project like the meme thing. If you say you can participate in research by making a meme, this may make people much more interested in participating. And finally, share your own personal successes and failures with staff. I think some nurses think that they can't contribute because they don't have an advanced degree, and that if you have a PhD, you must always do it correctly, which we all know is not the case. I worked on a project with a staff nurse as a resident, and she commented, you just knew what you were doing. And I recalled to her many other instances when I had no idea what I was doing. And the only reason that it looked like I might have known what I was doing is because I had done it before. And as she did this more, she would just gain more and more experience. And the same thing with publications. I let students and nurses know that I get rejected all the time. It's okay. We all learn by doing, and the more you do it, the better you'll be at it. Also look for easy successes, and this is mainly to disseminate information, as we know that dissemination of projects through maybe posters, presentations, publications, that's a major way that we measure engagement and success. It's a tangible outcome that we can attach numbers to. So for example, maybe local conferences where the stakes may not be quite as high. Help them submit an abstract or a poster presentation, and this again will help build their confidence and may boost their interest in clinical inquiry. Or if they're looking to publish, don't submit it to a highly scientific, high impact journal. Look for one that is a little more staff nurse friendly, that publishes practical clinical findings. And there are many of these journals in nursing. For some further tidbits on how to engage staff, here's an article that I recently published in Nurse Leader on how to win friends and influence people as a nursing leader using Dale Carnegie's book as a guide. And I wanted to end with an overview of some of the different ways I've included nurses in projects and research. Specifically in infection prevention, I've used staff nurses as auditors as part of a bigger implementation science study. I've used the structures in place of the DNP scholars and Ebp fellows. There are several clinical ladder projects, and I've partnered with several nurses who are just really interested in research. And throughout these projects, some I have led, some I have just provided support for. And this goes back to meeting the nurses really where they're at and providing the support that they need. I've also been involved in other non-infection prevention related projects, mostly with nurses advancing on the clinical ladder, some nurse residency projects and different things like that. And with that, I will end my section of the webinar, and we can, open it up to any questions.
Thank you, Stacy, and thank you so much, Ruth. Welcome everybody to the question and answer section of today's webinar. My name is Brady Granger, and we're really pleased to have such a big group of you here, and we're also pleased to have had so many great questions in the chat. So before I start with some of my own questions, let's take a few from the Q&A box. And the first one was from Karen Heider. How do you get organizations support for staff engagement? And this actually came right came through right after Ruth's talk. So I'll ask Ruth to take it first, and then maybe hear from Stacy as well.
I think that we're really fortunate here at Abbott Northwestern, but I think the key thing is having institutional support for engaging staff in research or clinical inquiry. And then that means you have to define what that looks like. What do you want to do? How help them know specifically what support means? And we had one of our retired CNOs was just a huge advocate for research and very well received in the community and very well respected within our foundation and the hospital system, Atlanta Health wide. She's was nationally known. And so she actually was a spearhead for a lot of this, in that she really got the foundation behind supporting nursing excellence and looking for funding, and got a lot of money put together. And but we had it all planned out how it would be used. So for us, you have to figure out a way that, it's really hard for people to want to give free time. If they're working at the hospital, they're already working, and they're not really wanting to work for free, even though it's research, and even though we might do that in our evenings and weekends. So I think it's trying to figure out, how can you engage them? And I love what Stacy was saying about making them, if there's existing projects, and they can be data collectors, and they can do that on work time. There's a budget covering, so they still get the experience and they can incorporate in their work, and their patient care doesn't suffer. So I think there's a couple different processes there that you can use.
Thanks, Ruth. Stacy, do you want to add to that? I commented back to Karen at the time that she posed the question of, you were right in the middle of presenting your slide on how staff involvement in committees is used. So maybe expand a little bit more. I think that's exactly what Ruth was saying. It helps both sides, the organization and the research.
I agree. And to how to get, organizational support for staff engagement, I think that you really have to be strategic about what projects you take on and maybe which ones you don't. And so I know that, staff might come with an idea and it's like, well, this really isn't a priority for the health system right now. We really need to focus on this list of things. And if you're able to have like a balanced scorecard or, kind of a list ready of, these are our 5 top priorities, and we really need you to focus on that. I think that that's a way to get organizations to support it, because you can say, we're really trying to help improve your metrics or whatever like that.
That's interesting, your response, because it leads right into the very next question from Perry, which is, as a nurse scientist in a large health system, Perry has a difficult time finding out about research and scholarly activities dissemination across the system, which we do as well. And so the question was, what are your ideas for tracking research and activities? And I think, to your point, it is important to track it in order to feed the information back to the organization and to the unit managers. Any specific thoughts or suggestions? I'm kind of wondering if you would share the way that you did tracking and feedback during the CLABSI project.
Yeah, so the project that Brady is referencing, so we did a huge central line bloodstream infection prevention project, and we did a really robust audit and feedback process where every week we were feeding back that data to the unit so they could see really in real time how they were doing with their process metrics and their CLABSI metrics as well. And it's noted in the literature that that type of, audit and feedback really helps, improve compliance with evidence-based practices. It is time consuming, but it is something that I think has a lot of benefit. And to your point about how do you track research, again, as Brady mentioned, super hard to do because there's so much going on. Definitely something that we struggle with at Duke. Hutch Allen, our EBP and research director, created a smart sheets for that, if you're familiar with that, where people are supposed to go in and, add in what kind of projects they are working on and things like that. And then that way we can kind of connect, there's no sense in like 10 different projects on falls prevention. it'd be helpful if people kind of communicated that. And I don't know if Ruth, if you have ideas and thoughts of how you've been able to track it.
That is the challenge, absolutely. So, because you can go in a million different directions so easily because people are so innocently thinking of ideas because they're motivated. And so trying to harness that energy. One of the things we're want to create and want to do it religiously or, in a ongoing fashion is to have people, we have our monthly nursing governance program. And what we want to do is have as a part of that during this hour when everyone's all together before they break into their different groups, we want to have research take 10 minutes or 15 minutes of that time to report out so that people hear it. And the pushback is, well, I might not care about falls, I'm in mother baby or whatever you may not think that topic pertains to you. And so what we try to do is encourage people that even though it might not be a topic, a clinical problem you're interested in, the methodology might be of interest to you or the process they used. And that's why you listen and expand your horizons on the different topics. So we're using that as one way. But we trying to coordinate and be aware of all the projects is tough. We do have our Nursing Research Council, and actually we've integrated all applications for EBP and research will come through that council to be done. So that's where we're started right now. We're trying to keep kind of a roadmap there of projects that are underway and where things go. But QI is a big part of that because they have all kinds of ideas of things they want done and activities. I don't know if that helps, but it's a learning process and it's like constantly changing. And I think, our website, we're working on a link so people could go in and see the master of tracking of all the different projects that are going on, as well as tools they could access.
Thanks, Ruth. Okay, let's take another question from the box. I think that this question maybe originally came from Paul. With the pandemic exhaustion, zapping energy, what are some of the strategies that you use? And some of these were given throughout the talk, but are there any, I guess I kind of thought that the meme idea was a great sort of game-based strategy, but are there other strategies that you all want to mention and share to keep people engaged?
That's a great question, especially with COVID, people are just tired. And I think, kind of setting your expectations low. Now isn't the time we're going to be doing like super robust, involved nursing research. It's just not. And so starting with maybe some again, what are some smaller QI projects on your unit that will help impact your workflow in your nursing practice that they could kind of quickly do. I think, a lot of times we do these big studies and then nurses don't know the impact that they had on that. So scaling it down, making sure that they're able to see the impact that they're making. And as Brady mentioned, I think that the meme contest that we did related to infection prevention last October was a really nice kind of break for them. It was something fun and simple for them to do. So if you're able to integrate something fun, game-based, I think that that's helpful.
I think the evidence that it worked was how many people were involved. I mean, that is really a testimony to the creativity of the team. So thanks for doing that. Okay, there's another question in the box too, actually from Stephanie, and maybe we could take these kind of together. The first was related to social media. In doing that, can you all provide some examples of what you post? Anybody?
I will admit that I do not have a good social media presence. That's an idea that I have not executed yet beyond the meme thing. But I do have an idea of being more involved either in Twitter or Facebook or something, just because that's how people communicate anymore, and that's what they're going to. They're not going to the hospital intranet and looking for a flyer. They're looking for a short tweet or a QR code for further information. So I really don't have any examples of what I post, but I'm hopeful to be able to just do, you know, kind of bite-sized QI types of things and tidbits that they can, you know, take that they're practical and they can implement on their unit.
I'll
I have
add to
another
that.
example. Oh, go ahead, Ruth.
I'm
Go
sorry.
ahead.
No, I was just going to add to that I haven't done that yet as well. But I think that's our strategy, is looking forward. How can we reach out? And one of the things we want to do is have a tweet that'll go out so we can invite nurses to participate. A lot of times we don't even have a really good way of alerting nurses to what the opportunities are, because you go through people. You know, if you think about email, it goes to the nurse manager and she submits it, she sends it to circulates it around, or you put a flyer somewhere that people aren't going to see. So the tweeting, I think it's going to be a really fun thing to really find out, you know, are you even aware that this is an opportunity? Keeping it fun, I think, is, and short and sweet and simple.
I think I feel like it's important to mention here that in response to the question, the American Association of Critical Care Nurses, their editorial board journal group has this year started tweeting for us. So for the staff nurses at Duke that have published with either the American Journal of Critical Care or Critical Care Nurse or Mary Fran's journal, Advanced Critical Care, that group is tweeting for us, and the staff nurses have been so rewarded by that, and they get it. They kind of get their own tweet. Anyway, it's been they've had blog interviews with the staff as the author group, and those have been really well circulated on social media. I think that this has been a really it's been a huge boost to everyone's morale, to be honest, and the idea was terrific. So I want to say thanks to AACM for that. These are great questions, so I'm just going to keep plowing through. I saw an important question from Stephanie about wearing a lot of hats and balancing your own research with the research projects that you're facilitating with staff. And I know you both are doing that. So any words of wisdom? Because I know the basic answer is it's really hard.
It is really hard. But I do think that the sweet spot is making sure, like, if my research interest is something that's attractive to others. And so I think I can, if I like wanting to do this research about pressure ulcer early detection, you know, I have somebody doing a piece of that on Courage Kenny in our rehab unit. So they're getting a part of that done for me as a pilot almost, but they're really excited about it. And then they're also doing the same thing over in critical care. So I think integration of the projects is probably what you have to, and Stacy, your illustrations were fabulous to show how you can, you know, integrate one topic and have it, you know, delivered in several different formats or implemented in several different formats. And I think that's the trick, so that you, so everything's really integrated as to what you're doing. But it's, and I think probably another really important expectation is to learn how to say no or not right now, which I am not good at. I flunk.
I think we're all kind of bad at that. Okay, let's see. Moving on. There's a great question about keeping university partners involved. I know you both do a great job with this, so who wants to go first?
That is a great question. Again, I think having that academic practice partnership, you know, where you can build relationships with those faculty members are really helpful. I think another way to really keep them engaged is making sure that whatever you're doing is mutually beneficial. And so, you know, there's benefits to both the health system side and the School of Nursing side. You know, maybe by being or by participating in, the health systems, research council, you might find nurses who are willing to be clinical instructors for your course, or might be, willing to come and give a guest lecture or something like that in your course. And it's kind of this reciprocal, balance where you're helping them and they're helping you as well. Maybe you can, increase the professional development of some of the nurses, and they can also help you with your classes, so being creative about, how does it not only benefit the health system, but also how can it benefit the faculty in the School of Nursing?
Great. That's a great answer. I think it's a little related. Oh, Ruth, did you want to add to that before I go on, Sandy?
No, I think
That's great.
I think Stacy's in a great situation where she has a pretty strong relationship with the institution, with an academic center. I have a relationship with probably 4 key ones, but I network by meeting with them at least twice a year, the different faculty, and then through the students, I become more aware and involved with the faculty. But you're absolutely right, having opportunities for them to help me conduct lectures and presentations is fabulous. And that's another way that we're engaged, and they know what our priorities are here, so they can see where we can mutually meet each other's needs.
Yeah, thanks. That's great, Ruth. April Bruni has a great question that we're going to have to take. We will go ahead and take it offline because I think we're running short on time, how to succeed without a designated nurse scientist in the role. And then Sandy Hagstrom's question, which I'd love to get to before we end, is some of the examples are within the scope of practice of other practice leaders like clinical nurse specialists in the organization. So how do we differentiate the nurse scientist role and not step on toes of other practice leaders and maybe take advantage of their skill set as partners? But go ahead. Who wants to start?
That's a great question. And I think it, involves some, you have emotional intelligence and building relationships and trying not to step on their toes, but seeing how you can really partner with them and collaborate. You're not in opposition to one another or trying to do the same thing. You're there to help, improve maybe the rigor of their project or something like that. So I think, not taking it from an point of I'm stepping on your toes or I'm taking your project, but really how do I collaborate with you and kind of bring in like a CNS to your team, I think would be, very beneficial.
Yeah, I agree. Ruth?
Totally agree. That was really well said, Stacy. And it's not a competition. They have strengths, we have strengths, and I work with the CNSs all the time, and there's there's many things they do I can't do, but I can strengthen the methodology significantly. I might help them with the writing, so there's strengths I'll bring. So I think it makes your practice better. I can't imagine practice without it.
Working together. So I just want to say that other questions in the chat, we will answer those offline as we're kind of at the high water mark. But to summarize, Stacy and Ruth both gave a couple of key common threads that I just want to review. They both emphasize the importance of connecting with staff and being present with staff in order to form relationships that are successful and that can build the science in a I think more rigorous and a way. They both talked about making opportunities for staff and disseminating those opportunities broadly, as hard as it may be. And we could talk more about platforms for sharing, creating networks and partnering with both the academic side and also networks within the health system. And then always being available to be a resource, which is, I think, one of the most important aspects that you both mentioned, which is just being there and offering partnership and expertise. Help staff. Thank you, everybody, for being here. So we want to talk in the last minute about the CANS conversation with the experts. And this is an opportunity to network and take a deeper dive into the content with the speakers of this webinar and perhaps ask additional questions that you thought of and we didn't have time to get to. This is an exclusive member event, so please join CANS, and especially this special interest group would love to have you. The exclusive event will take place on Tuesday, August 3rd from 12 to 12:45 over Zoom, and space is definitely limited because we want to be able to engage in a relationship with you. So thanks for taking the opportunity to join us in a one-on-one event, and to register, the link is here, and we will distribute these slides and this recording. And just to end, I want to thank everybody again for being here, for being a member, and for taking advantage of these webinars as one of your CANS member benefits. And thanks so much to the Academy and the recording team.